Lanai Carter is a mother and carer of a 19-year-old brain tumour and epilepsy patient. Lanai has a background of many years senior business development in the finance industry, holds qualifications in financial planning, clinical hypnotherapy, mortgage broking, and is a landmark education graduate. She is currently studying a Master of Business Administration. Lanai was co-founder of the non-profit Medical Cannabis Advisory Group, a patient advocacy group with a focus on law reform and human rights. Lanai was strictly anti-cannabis and raised with very conservative views. Her entrenched negative opinion on cannabis was completely turned on its head when her son was recommended and successfully treated with medical cannabis by doctors in the USA. Through her research and observation, she realised that her views on cannabis had been completely wrong. Lanai spent a year in the USA where her son was treated by leading cannabinoid clinicians and other doctors. She was in Washington State when the medical cannabis regulations were transitioning to full legalisation. Upon her return to Australia, she established a medical cannabis advisory group with her son's advocate Grace Sands and commenced lobbying and petitioning the government to change the health, drugs and poison regulation in Queensland. After 19 very stressful months, this finally resulted in Lindsay being prescribed the first Schedule 9 TGA botanical cannabis approval in Australia and Queensland. The Medical Cannabis Advisory Group also successfully had the Category A regulation overturned at a federal level after their submission, petitioning and lobbying for a motion of disallowance which was taken up by the Greens Senator Di Natale. This has allowed patients with terminal and life-threatening illnesses to be able to be prescribed fast-tracked access to legal medical cannabis, just as they can with any other drug. So I'll invite Lanai up to talk now.
Thank you, John. And I'd like to also thank the Queensland Council of Civil Liberties and the Kurilpa Citizen for allowing me to speak tonight. I'm going to be speaking from a patient and carer perspective this evening and really focusing on the impacts on the medical cannabis legislation in this state. And I really want to delve deep on some of the issues that are impacting patient access across the board. So before I do this, I would like to just provide a brief overview of the journey that we've been through over the previous few years, and also briefly describe some of the changes to the legislation and regulations as mentioned by John. So in March 2015, my son's doctor submitted an application to the TGA and to the TGA for my son to be prescribed medical cannabis. He also sent a copy of that to the State Health Department, and we sent that to the Justice Department as well here in Queensland. The product that we initially were trying to import was a product that had been used successfully overseas. And overseas, Lindsay had been recommended medical cannabis for his condition, which includes the brain tumour and epilepsy and the symptoms associated with that. So in the US, we did have good success with the treatment of his condition. He had got some reduction of his tumour and edema, and also a good control of his seizures and good symptom management of his pain and nausea and vomiting. It also helped to stimulate his appetite, so that was very important when he would wake up in the morning and have no appetite to eat anything for the day. We did come backwards and forwards that year, and the time that he was off medical cannabis, there was some growth of the tumour. It was about 4 millimetres at one point from memory, and at another stage at the end of coming back from the States, it did grow a few millimetres when we got back. So that was very difficult. But when we came back from the States, we did and had met Grace, who became Lindsay's advocate, and she advocated for him and also helped me with dealing with the government and the departments up here. So basically we co-founded the Medical Cannabis Advisory Group here in Queensland together, and we had sent a request to the Office of the Attorney General Justice requesting a change to the Health, Drugs and Poisons regulation here in Queensland, because we knew that Lindsay wouldn't be able to have access to these products unless that regulation was changed. Little did I know that it would take so long to get a response. It took months. We had been waiting for about 5 months. We'd had no response. And then Grace and I went and met with the Attorney General Justice one day, and she reassured me that she would look into it and she'd be in touch with us. Some time passed and we didn't hear from her. So at that point we actually started a legal process, and we commenced that legal process with the Justice Department. We gave them 30 days to let us know why they hadn't responded to our initial request, and we were preparing to take it to court. However, at the end of the 30 days, they did ask us for an extension of time. We didn't know what to think about this, but we did grant them an extension. And basically, by this stage, we'd already been waiting for 6 months. It was just it was a hellish wait trying to get this medicine sorted for our son. So we completed a number of petitions that year and gained over 9,000 signatures from people throughout Queensland, including a lot of paper signatures, over 6,000 I think there were paper signatures. We were calling for changes to the regulations and an amnesty for patients like my son and everyone else up here that was suffering. So we did finally hear from Justice, and they reassured us that Cabinet meetings were taking place and that the Health, Drugs and Poisons regulation would be changed. And finally, there were changes made to Regulation 270 of the Health, Drugs and Poisons regulation, which allowed any doctor in this state to potentially prescribe medical cannabis for a patient if they felt that that was suitable for them. The other thing that regulation change did allow was for patients to be able to be prescribed medical cannabis through trials. And the government were coinciding a trial with the changes to the regulations as well. This change to the Health, Drugs and Poisons regulation was kept very quiet. It was a blink and you'll miss it kind of announcement in the Courier Mail. Very few people knew about it, and in fact the MS Society were very shocked at one point because they hadn't been notified about this change, and they thought that any patients with MS couldn't be prescribed cannabis till the year after. So we were quite shocked that these groups hadn't been notified. Anyway, by this stage, finally Lindsay's application could be approved, and we believed that at this stage his medicine would be shipped within weeks. It had been with the TGA for 9 months by this point. We had been told that it would be just an informality, that the doctor would send a copy of the approval, the TGA approval, to the State Health Department, and then he would be able to have that authorisation to have the medicine in the state. It wasn't that simple. Basically at that time the doctor was informed that he would need to complete a whole new application to the State Health Department, and that they may take up to 90 days to assess it. And at the time I remember having a conversation with the Health Department just saying, how can that be? The TGA have already looked at his medical history, all his medical reports. They've assessed his suitability for having this medicine. They've already looked and scrutinised the supplier, the certificates of analysis and all of the information. But they said, look, I said, you're basically enforcing all the things that they're proposing in the new cannabis bill on our son before it had even become law. And they said, that's right, that's what we're doing. So we had to wait for that to happen. So it was very, very frustrating thinking that there were further delays to accessing his medicine. As these delays occurred, I remember the doctor getting a very long list of things that were required for that the State Health Department needed to be sent in. I was thinking to myself that they've already got this. It was a 196-page application. It had already gone in. All of those things were there. I was horrified to think that they were still asking for more information. It just felt very much like stalling. And at that point, 60 Minutes got involved and they did a story on the duplication that was occurring, 2 lots of applications for patients at a state and federal level. And the day after the 60 Minutes got involved, Cameron Dick called a press conference. I thought, well, what can I do? What can I do? I spoke to 2 journalists that I knew and trusted. They went into that meeting. I handed over my son's application to them. I trusted them. I said, look, take this in. If they're telling you that they need more information, and you can see, I prepared a list of all the documents they had. If they're telling you that they need more information that you can see that's already been provided, use this information that I've given you. Hold them to account. This is just so unfair. Patients shouldn't be made to wait. Those 2 journalists went into that room, and when the health department started to say that they were requiring certain documents, they looked at their list. They said, you've already got that. You've already got that. Pulled the paperwork out, set it on the table. And by the end of that meeting, the list of requirements or requests had gone from, I think there was about 2 pages originally, and it had gone to just 2 items that they needed. And they had reassured the journalists that there would be a decision made by the end of the following week if those items had been provided. They didn't quite stick to that timeline, but the information was provided and things were able to progress, and we did actually have to put the health department on notice, the Director General Health on notice, and the approval finally came through. Basically, the bill passed unanimously anyway. I honestly feel that the politicians that allowed that bill to pass were believing that they were doing something very good to help patients, but they were failing to look closer and understand the true impact on patients that would have. I feel that often this has been much of this has been token legislation. Government trying to give an outward appearance that they're providing medical cannabis to suffering patients, when the reality for patients is as far from that as it can possibly get. So I guess, having spent some time in the US, it's very hard when I look at how much easier it is for patients there, and I look at how hard it is here. And one of the things that really stands out for me is that a doctor can sit down with a patient, they can look at their medical history, and they can determine immediately in the legal states, obviously they're not all legal states, but in the legal states, they can make that determination whether this patient needs this medicine or not. And within basically in a lot of states, as soon as they've made that decision, that authorisation is granted, the patient can get access to the medicine immediately. They don't have to wait days, they don't have to wait weeks, they don't have to wait months. And in this state, they are waiting for months. And over a year, in Lindsay's case, for the first one, a lot of that time was the laws being changed and things like that, but there was still considerable delays and duplication. So I guess with the other thing that really stood out for me is that it's not efficient under the current system for doctors to make changes to a patient's medicine. If they need to change the dose, if they need to change the ratios, or what sort of cannabinoid formulation they're getting. It's a very clunky and completely inefficient system in comparison with the prescribing of any other drugs in this state. In Australia and in Queensland, we're in a difficult situation where legislation has moved faster than supply. Currently, all legally supplied products must be imported from overseas until the Australian companies are in that full cultivation and manufacturing phase. Many companies are still awaiting their cultivation permits, and others are still trying to obtain their licences. So there are considerable delays for those companies, and that flows on to the patients. The companies that have got plants in the ground are still in research phase. So the other issue is that when these products are available, they'll be unaffordable for the majority of patients. There's one patient in this state who has already been quoted $15,400 for 3 months' supply of medical cannabis for a condition. It may be years before cannabis is on the PBS, which will, in the meantime, that's going to cause issues with affordable access. If legislation cannot cater for pensioners and low-income earners to be able to afford this medicine, it's a failed legislation, completely failed legislation. In the USA, in Washington State, and in other places, the laws accommodated affordable options for patients, including patient cooperatives, the ability for patients to be able to cultivate their own plants, with legislation in Washington State restricting limits to 4 plants per patient, with no more than 15 plants per household. Other states, such as California, dependent on county restrictions, could allow authorised patients to grow as many plants as recommended for their medical condition. I am hearing that generally they say about 6 plants, unless you really want to take it to court and fight that you had to need more than that. But other countries such as Canada, you're probably aware that there have been court cases to protect patients' rights there. Patients are able to grow their own plants there if they're authorised. I guess what I'm getting at here is there needs to be affordable options, and these don't necessarily impact industry. There's still plenty of demand for industry, even if patients have these affordable options available to them. The dispensary model overseas was very good in many ways because of the choice of products available for medical patients, the ability to access those quite quickly and readily. There was no concerns about delays in supply or interrupted supply. After my son's 3rd approval here in Australia, he faced approximately 7-month gap in supply because it took so long between the application at the state level, the application at the federal level, the import-export process and the medicine. There were delays with the medicine coming from overseas. There was a strain unavailable at one stage, and that caused a huge gap in supply. These are the sorts of issues that just can't happen. If that's a medical cannabis oil that an intractable epilepsy patient's relying on, that can't happen. It just can't happen. It could take lives. So another thing we found in Washington State, it was possible to get testing of products, even if they were coming from a dispensary as a patient, it was possible to take that and get it tested. Here, we haven't even been able to get that right for legal products, let alone there is the Pelican study, which is doing testing for paediatric patients in this state, and I believe in New South Wales, but definitely here in Queensland, where they are testing the cannabinoid levels of the medicines that are being used from the unregulated market. Now I'm going to delve a bit deeper with some of the issues here. So there are many general practitioners that are wanting to prescribe medical cannabis for their patients. They believe that will be beneficial for their patients. Some of them, they understand their medical history. Some of them may even be fully aware that they've been using products from the unregulated market with success, okay? So these GPs that know their patients the best, they are the ones that should be the ones making decisions as to whether medical cannabis should be prescribed. That shouldn't be taken out of their hands. The GPs fall into what they call the single patient prescriber category. They should be able to just get on with doing what they do best, working out what their patient's needs are and prescribing it. However, there are significant hurdles to overcome. The main challenge is that the State Health Department are requiring specialist letters to support those applications. And often there's many patients that don't even have a specialist to begin with. So then they have to go through the rigmarole of waiting for months and months, in some cases, to access a specialist through the public health system. If they do have a specialist, then there's no guarantee that that specialist is going to be allowed to or prepared to support an application for medical cannabis for various reasons. It may be a lack of education around prescribing, it may be restrictions with insurances, it might be the hospital, policies that they're not allowed to prescribe, who knows? But there's definitely a lot of that happening. So we're sort of hearing feedback, that in some of the hospitals there's a blanket situation where they're being told not to support or not to prescribe, unless of course it fits in with a trial that they're running, and there's very few of those. There was a recent situation where one patient was told by their pain specialist that they would increase their fentanyl, which they had been trying to reduce, and put them on methadone instead of prescribing medical cannabis. That as an alternative. That's just very devastating, especially when these patients are dealing with years and years and years of chronic pain and they're pretty much at the end of their road with having tried everything. So it's just so devastating to these patients. So if you look at the alternative, the prescribing of opiates can be done same day. Why cannot cannabis? There has been obvious limitations. You've probably seen a bit in the media about prescribing of them basically saying they will not prescribe THC products to children in the Children's Hospital. This has been a huge frustration for families and very, very frustrating and devastating. Very stressful. These are people who've been trying to work with their specialists to come up with a solution, a legal solution, and they're left with very little choice. I've already talked about the time it takes to get these applications through. The roadside drug testing is obviously an area that needs to be looked at here. We have a situation in Queensland where any patient who's being prescribed a medical cannabis product that contains THC have to sign an informed consent form which says, I also understand that I am not permitted to drive a motor vehicle or to operate heavy machinery whilst being treated with a product containing THC, and that this constitutes an offence under Section 79 of the Transport Operations Road Use Management Act of 1995. Whatever happened to a common sense approach where labels are put on medications, other medications, to provide warnings to patients if they're having those medications and driving, or to avoid driving if they're under the influence of those drugs, but to use more awareness and education just like they do with alcohol. That's what we would see overseas. There was awareness campaigns. Don't drive when you're heavily medicated. The sobriety testing made a lot more sense because there were patients that would metabolise their medical cannabis at such a rate that they were able to drive safely after a period of time. So I think that's an area that really needs to be looked at here. And you can imagine if you've got a chronic pain patient or any patient with any chronic illness or PTSD, a lot of them are already isolated enough. Take their option away from them to be able to travel or transport themselves in a vehicle and get out and about and socialise and see people. That's devastating. It's horrible. So I guess the difficulty is if these patients are hitting brick walls at different stages throughout this process, or the process is deemed too difficult, what's it going to do? Those patients are going to either suffer or they're going to turn to unregulated suppliers. Our son can't actually access the medical cannabis oil in the right potency that he needs for his condition. We can't import it from any country at the moment. We are trying. We cannot import that from any country. That will come in time, and those products may be available here in time, but patients don't have time to wait, because we know that any day that goes by when he can't get the right treatment, he's at risk of seizures, and he can have up to 20 seizures a day. So that is devastating for him, and it's devastating for our family, and it has huge impacts on every aspect of his life and our lives. It's just unfair that any patient should be left suffering. So currently Lindsay is getting one product in from overseas through the TGA Special Access Scheme, but the other product we can't source. We often hate being here. We hate being in this country. We're devastated by these kinds of legislations and regulations. Patients across this whole country are. It's got to get better. It's got to get better. Really, I mean, that's my. In closing, I guess that's my message: is that things have to improve. The government may be taking measures to try and legalise medical cannabis and make it accessible, but it's all too slow. The products that they've imported from overseas, the bulk supplies that they've imported from overseas and warehoused in Australia to make access for patients faster, there's not enough options there for a lot of patients. Some of those products aren't at all suitable for patients. They're either too dilute, or they're not the right cannabinoid profile. And the other thing is the affordability issue. Patients could be looking at hundreds of dollars a day to treat their loved one, to treat themselves or a loved one, instead of something that shouldn't cost anywhere, like a small fraction of that. I just hope that things can get better for everyone that's impacted in any way, and patients deserve peace of mind. They deserve to get on with their lives. They deserve to have quality of life. I know that there's one patient in this state, their doctor has been waiting for 5 months. The legislation here says that the state health department can take up to 90 days to assess an application. And they've had this one for 5 months. So wrong. Anyway, we can hope that patients will get the chance to live their lives, have quality of life, have affordable medicine. We can only hope. Thanks for your time.